Welcome to the Roselle Center for Healing in-house educational program. I'm your presenter, Dr. Stephanie Pina, licensed naturopathic physician, licensed acupuncturist from Virginia, and member of the Roselle Center for Healing team. I'm going to be your presenter tonight, and we're going to talk about uniquely feminine new perspectives for women's health in 2021. Feel free to watch this program all the way through or to jump to sections that you might have more interest in. And hopefully you'll learn one or two things that will help you become more advanced in your knowledge about women's health and medicine. The first thing we want to do is bring importance back to women's health. Not that it's lost importance, but essentially women's health has become just reproductive health in itself. And what we need to do when we're addressing women's health going into the future or from a holistic standpoint is to essentially figure out why we weren't talking about it to begin with. It's common that the female body was considered taboo in the past, and so a lot of the times different generations didn't talk much about women's health or pass on that same kind of knowledge to the next generation. A lot of gynecologists were originally men and that couldn't connect with the women that they were doing the exams on. And even some of the modern day topics such as transgender switching and also hormone replacement and infertility can be things that are difficult to basically present to not only between patients and practitioners, but also to family members as well too. One of the unfortunate things is that there is a lack of research with females involving their lack of representation. In research studies, usually things such as cardiac risk, how a woman responds to medication, as we'll be reviewing in just a moment, are really based off of how a healthy male would basically respond. So as we move forward into the next century, hopefully that will start to change and then women will be able to be included a little bit more into their own research as well. And you also have an increased number of women researchers present to help drive that. There are a number of biological and physiological changes that basically are different between men and women. And what's interesting is we think often how children will go to pediatricians who just specialize in that age range. And we have gynecologists and urologists who may basically be specialists in reproductive or urinary health. But essentially, we don't think much more beyond that. A primary care physician is supposed to be able to treat a man and a female the same. However, they have to recognize that there are biological differences more than just the reproductive system. Usually women live longer than men as well too, so it's very important that women's medicine continues to grow and we find out what makes women not only live longer, but how do we keep them in a healthy functioning state at the same time. Women typically are the ones that are left out of research studies or out of certain medication studies, typically because of their cyclical changes. When you see women going through puberty, pregnancy, menopause, those estrogen levels and those other hormone levels that are involved with it can essentially change some of the results in those studies. So it's easier to have someone who doesn't have fluctuating levels of hormones be your research subject. And we also have to start to consider new issues that are basically happening and bring attention to how we need to change up our current system, not only to identify and address their issues, but also to basically find out the best things that might work for them that might be different than a woman that's typically born female. This might include transgender women, access to different types of care, not only in our country, but in other countries as well too. Increase access to infertility issues and understanding that 50% now of infertility issues is male and female. And essentially we have to make sure that fertility is more options available for payment, whether it's a homosexual couple, a heterosexual couple, or a transgender couple as well too. And we have to make sure there's more information about menopause and what's the normal signs and symptoms, since a large majority of the population is going to be in menopausal ages in the next 10 years. So one of the main things we asked is who do we go to for help to begin with? As I mentioned, OBGYNs focus on reproductive health pretty much only, especially nowadays. If you try to get regular blood work done through an OBGYN, you may or may not be successful. So that's where a holistic medicine practitioner who understands the importance of the changes in women's medicine and the changes in their physiological bodies is of great interest moving forward. So one of the things that's really hopeful is we are starting to see more information brought forth, and some of that has to do with the different types of science and social media that basically has come forward, giving people more information. Women are used, like I said, in less research studies than men, but they contribute more of a role as far as treating some of the hormonal issues. In fact, the FDA had to start to include regulations to have women in medical trials to make sure that it was an equal balance of male versus female, just the same as they had to basically see if medications would work for one age range versus another age range. Were they even safe for, say, a pregnant woman to take, and what the safety levels were. So just like this in science, women become one of the main things that drive new changes that goes on. One of the great things with social media is that women are also trying to take charge of themselves by bringing more attention and focus to certain issues. These young celebrities down here at the bottom are basically driving research and change and funding and attention to their different causes, such as Angelina Jolie working on the effects of breast cancer and mastectomies. Katie Couric also with Kathy Bates talking about lymphedema and the risk of lymphedema after breast cancer surgery. Suzanne Summers was originally one of the ones that wrote one of the books on bioidentical hormones and hormone replacement back in the 90s. And nowadays, Amy Schumer, I have to open up with her information about her struggles with IVF and infertility. So women are really trying to reach out to others and tell them that their issues are going to be completely normal issues, and it's maybe a voice that they never heard before. So let's get into some of the science of what makes men and women different. So let's now start to talk about how women break down medications. Now, you would think in a holistic medicine lecture that this wouldn't be as important, but essentially so many women, and so many men for that matter, are on so many medications that we have to think about the way that the drugs affect the body. If we can think about how an outside influence affects the body, then we can kind of understand how to heal the system and where there might be issues going wrong. We see this change starting to happen when people start to investigate epigenetics and how the environment affects us, how the environment affects our genes. Well, essentially, those genes can also turn on and off how we break down our own nutrients and drugs and different types of things within the body, our own substances, essentially. So for the female body to be different than men's, then it makes it very interesting to know that we have to essentially look at how we give drugs out and how we break them in and take them down. And remember, a drug can be any substance that basically has some kind of therapeutic value. So a drug could be seen almost like a vitamin or magnesium supplement. It could be also a drug like Premarin given to menopausal women. It could also be essentially a drug that we don't know that we're currently ingesting, like a pollutant. And it could also be something recreational, such as cocaine or heroin or an opioid. So essentially going through and understanding how women break down medications is going to be helping us to understand the body overall. So what we notice is that from experience and from research, women experience more adverse effects than men when it comes to medication and breaking down medication. And those adverse effects are more serious in women. 8 out of 10 drugs withdrawn from the market between 1997 and 2000 were withdrawn because of greater evidence of adverse effects in women. So essentially what happened is that the female population were having so many drug responses that most of the medication taken off of the market before 2000 was essentially because of interactions with women. Among the limited number of new drug applications for different pharmaceutical drugs, that includes sex analysis, where they did break down how medication would essentially affect a man versus a woman. There's at least 40% difference in pharmacokinetics between a man and a woman, but no differential diagnosing was recommended to have been made in these drugs despite the difference. So essentially what that's trying to say is that 40% of the drugs that became new drugs that were researched and then put out on the market, they noticed a change of how men and women broke them down, but they didn't make any dosing changes as far as recommendations to physicians or to pharmacists on how these drugs should be given out between men and women. So essentially, as you'll see in the upcoming slides, women might have a chance to not only add more events, but the effects from the drugs and medications, but they can also have more serious ones because essentially the dosing wasn't properly done. The difference in pharmacology between men and women, sometimes it gets very confusing and very technical, but essentially we're going to walk through some of the big differences. And this is very interesting when we think about not only taking medications, but why do women tend to react more? Why do they report more in adverse effects? So first of all, we have to think that there are physiological differences between men and women and how we metabolize drugs. Women typically have different types of body length. Their height and weight might be different. their total body water and extracellular water, and also their body fat may be different in the way they break down and utilize drugs. This is known as pharmacokinetics, or how the body has an effect on the drug when it's breaking down, or pharmacodynamics is the actual drug's effect on the body. So that can actually change between different types of drugs and medications. Men and women also have different kind of chromosomal effects. So this tends to happen in the first phase of liver detox, where essentially a drug or metabolite comes into the body and has to be broken down by different enzymes that also require certain types of enzymes and cofactors. So the cytochrome 3A4 and cytochrome P2P6 are basically the ones that have a different types of expression in men and women. Unfortunately, those are also the two most popular types of enzymes needed to break down a majority of medications that we use. Because women tend to have a slower basal body rate as well, they don't break down the drugs as quickly. So that means they're not breaking down things as fast as they meant to be going in. Women also tend to be more overdosed, more sensitive, and have higher severe reactions than men. Normally, this is because of the first thing, the physiological difference. It could be because they have more fat and more body weight that typically allows the drug to stay in the body longer, or as we talked about before, it's getting processed either slower than it would in the male body. So this becomes very interesting when you have types of things like insulin, hormones, different types of medication for the heart as well too, and how quickly they have to be able to react. And adverse events are usually reported more in women than men. It might be also because women tend to be much more on different types of medication throughout their life, and they might actually see that might be what's causing the increase in risk. If you think about it, there are very few women nowadays that weren't exposed to having birth control pills while they were in their teenage years, perhaps even fertility drugs and medications with higher doses of estrogen during their reproductive years, and then they may even transition into having to use reproductive hormone replacement therapy when they suffer menopausal symptoms. So essentially that's an entire lifespan through reproductive years where they might have been on some kind of drug. The fact that that's just a baseline and then throw any other medications in there already puts them ahead of the curve. The final thing we want to look at when we think about pharmacology differences is really how do we break down drugs. So this is the pharmacokinetic side of things. And so to make it easier, I just wanted to go through a simple way of thinking when a drug gets absorbed into the body or a substance gets absorbed into the body, the first part of it, we have to take it into the mouth or into the skin. And either way we look at it, there's different things that happen that have to make that drug or metabolite active. And the reason why this is important is because when you have something that's a fat-soluble skin, like that's on topically applied, typically that can not only change the skin on the outside, but it also changes the skin on the inside. They tend to hold on to medication a little bit different. In the stomach, basically women have lower chances, thresholds for basically alcohol toxicity, so they're not able to break down certain alcoholic beverages as quickly. Their gastric fluid tends to be more acidic than actually males, so different time-release substances that need less of an acidic stomach to go into place, just like with taking a probiotic per se, you may not be able to break them down as, you may be breaking down quicker if you're a female. And females' gut transition time is longer, so actually clearing that substance out of the body or clearing a food out of the body is actually going to take more time. It's almost close to half as much time, 48 hours versus 91.7 hours. When we think about transporting a drug throughout the body, the amount of estrogen that's basically in the body also creates like a protein that helps to bind substances. So a bound substance can not only go throughout a bloodstream much quicker, but then it also stays in an inactive state. So essentially you have unused medication lingering into the body. The lipid levels or fat levels slow down metabolism as well, and it can increase more so in pregnancy. Thus you see a lot of different changes in pregnancy that changes the way they metabolize drugs. There was a pregnancy and lactation labeling rule that was done in 2015, which essentially not only had to change the way drugs for lactating women, pregnant women, and whether or not those drugs could cross the placental barrier for females, and also in that same category, male and female reproductive potential drugs. They had to essentially change how they labeled them because of how the differences were in those different stages of life. Drug metabolism and biotransformation can happen in the liver and also other sites such as the lungs, kidneys, and skin. But women with placenta and fetal tissue also have metabolism there, thus affecting another part of their reproductive health. And certain medications actually break down or speed up their clearance through the body. So in this particular case, heparin actually clears out slower, so blood thinning can happen for a longer period of time. Aspirin will clear out faster, so they may not get the pain-relieving effects that they're looking for. And prednisone has a higher clearance in men, leaving the negative side effects of increased prednisone can essentially happen in women a lot easier. This might be even more something to look at with women who have chronic reactions who are using prednisone with autoimmune diseases. And finally, when we're talking about what we do with these medications is we have to eliminate them out of the system, or phase 3 detox. And essentially, women have a higher rate of clearing out medications that are in the kidneys, so essentially they're able to move drugs faster through their body. However, during pregnancy, pregnant females are able to actually surpass men after their 20th week of pregnancy, and it's also easier to actually help to increase pulmonary excretion as well too. So the time during pregnancy is going to decrease how fast or slow drugs are transported out the body. So if we're giving the same drugs or medications or even supplements, and essentially at different stages of a woman's life, we have to make sure that she's able to clear it and use it properly and effectively, instead of just relying on some of the base information that might be based off of male studies. So when we look at what the liver does in the body, whether it's a male or woman, you can clearly see there's a lot that's going on when we talk about detoxification of different types of medications. But essentially, this is also the part of the discussion that starts to increase how nutrients can get involved. How do we essentially help correct some of these balances if we understand what's going on in the feminine liver? And essentially what you're seeing here is where a lot of this detoxification happens. There are 3 different phases, phase 1, 2, and 3. And briefly to go over them, phase 1, which involves some of the enzymes we talked about earlier, its job is to essentially take toxins that are more fat-based and break them down into a less fat-based type of solution. That makes them easier to actually carry throughout the bloodstream, or what they call an intermediate metabolite. Unfortunately, at this particular stage, it's very toxic to the body, and a lot of times you have reactive oxidative intermediates or free radical damage that can happen. So when we try to support the system, we don't want it to actually, this drug to remain in this state that much longer. We want it to continue on to phase 2. And phase 2, basically what we're doing is we're making this somewhat soluble solution of our medication into the most active form it can, so it's water soluble. In that particular phase, basically we can essentially utilize the drug or the medication or the supplement the way we need to, and essentially give it purpose. Once that's actually done, phase 3, which is least talked about, it needs to actually be gotten rid of into the system. Some medications and some supplements, just like some body of fluids, like some of our electrolytes and water, will actually get reabsorbed into the body. This is a normal process, but most of the time it's being broken down, and it'll be either excreted through bile and then go out through the feces and the stool, or it can also go through the blood to the kidneys and then be excreted as urine. Other ways the body actually detoxifies is also taking into consideration sweats for sweat glands, the lungs with breathing out, say, carbon dioxide and oxygen, and essentially even our liver can be supported in a number of different ways to help these particular processes as well too. So as you'll see on this slide, there are a number of different nutrients that are needed as cofactors. So when we talk about the women and their ability to basically have drugs last longer in their system because their livers may not be reacting well, they may be exposed to different types of medications that counteract each other. Some of these vitamins are ones that we can actually go in and help to support the body, and you can find them in food sources, or you can actually give them in supplemental form. But you're actually changing the biochemistry of the female body in order to help the liver detoxify and utilize the best sources as possible. The thing that we're not taking into fact is also the fact that there are outside sources of toxins that affect how we produce and break down things. So these things could be such things as like endotoxins, which is normal products of metabolic metabolism, bacterial endotoxins that basically are being exposed to different types of infection we have, and then finally exotoxins, which are different types of toxins outside of the the body, such as xenotoxins, which give us an extra source of estrogen, different types of food additives, household materials, and even pollutants and chemicals. So overall, understanding this from a physician standpoint helps us kind of understand how to support the human body. Most patients don't have to learn the detoxification pathway, but it's good to know that there are vitamins and nutrients that kind of help support the whole process if we know exactly where the problem's going wrong. Now, that being said, we should also take a little bit of interest into how nutrients or supplementation actually affects the body. Women are known to actually have differences in what their needs are throughout their different life as well too. So it could be something that we're seeing measured on a lab report or what we're getting from a symptom when we're talking to a patient that we kind of understand that these needs might be different. So I put down a couple of quick examples here to show you the difference. Women's iron levels will actually change throughout their life depending on their menstruation. A woman who has a really strong, heavy bleeding to the point where she might be even needing to take medication to stop menstruation may lose a lot of iron and extra nutrients through that menstrual blood, actually becoming anemic at times. So women need to incorporate, say, more iron into their system during if they have heavy menstruation or during that time. Once their menstruation stops, you may not need to have the additional iron in there. So iron levels can be checked by looking at its levels in red blood cells and also then deciding whether women need to have, say, a multivitamin that includes iron and copper or not. You'll see certain levels of supplements needed to increase for different types of women's issues, and we'll talk a little bit more about this later, or maybe ones that you commonly know of. Think of, for example, of increasing or looking at the levels of calcium, magnesium, and vitamin D for osteoporosis. Usually those are the only supplements that are talked about, but essentially you need a lot of other micronutrients to make sure that those large molecules get into the system. So women may need more of these smaller substances than, say, a man would if they're trying to protect bone health. The other thing you might also see too is their levels for different types of B vitamins and water-soluble vitamins may be increased if they're on some kind of hormone replacement therapy as well too, help supporting the adrenals to function better and helping know that most of those medications deplete B vitamin sources to begin with. And supplements that are also can be created for women as well too. We're seeing this more and more over the counter, and we get asked these questions all the time. Is this the right supplement for me? And the fact that more and more women are using them means they're paying attention to the things that they particularly need. Essentially, an example of this might be even probiotics. So probiotics are essentially good bacteria that exist sometimes normally in the body and sometimes we're adding to the body to help break down food and help in the digestive tract. Well, typically the Lactobacillus series and then also the Biochemistry are typically the ones that are listed here are essentially the ones that you see often in women's probiotics over the counter. And because basically what they try to do is keep essentially an area like the vagina more acidic so it's less likely to develop disease and infection, they also are helping to break down different types of estrogens, and other research have shown that it tends to be more effective in women than men. So these are ones that you'll typically see in multiple doses along with or by himself in a probiotic supplement. And finally, we want to go back to the digestive system, the liver, and the kidney to help support what we need during a woman's different phase of her life. We look at this from a holistic standpoint, not only saying that they're depleted in this particular mineral, but what they might need is essentially a boost because their body's using a lot of these vitamins and minerals for a different thing. Magnesium is one of the most used vitamins and minerals throughout the body. So just because we put it into the system to help out with liver and kidney support doesn't necessarily mean it's going to be there. So we have to make sure that we're giving it enough. So one of the things that happens when we talk about uniquely feminine is we always end up doing a hormone review. So we're going to look at the hormone connection, which typically tends to involve the sex hormones, but some of the other hormones that are released in the body that have an influence. Some of these hormones are going to not only affect overall and general health and well-being, but actually play specific areas when it comes to how to treat certain types of conditions as well too. They're often overlooked on how the liver, the adrenals, and essentially things like the kidney and the stomach and the thyroid can essentially have an effect on the overall health, except for they're just looked at by themselves. I have a thyroid condition. My liver is not working well. I have adrenal fatigue. But how that plays a bigger picture in the whole process of the hormones can really help patch things together and come up with the best type of holistic treatment plan as well too. So let's review some hormones. When we're talking about the sex hormones, especially with women's medicine, there tends to be a large focus on estrogen. But we have to remember that estrogen is one of only 3 main sex hormones that are available basically in men and women, which is estrogen, progesterone, and testosterone. So we're going to focus a little bit on estrogen because it tends to be the one that's replaced the most into the system and also has both positive and negative effects. When we think about estrogen, there's 3 different types of estrogens, and these can be actually measured in the blood, which we'll check out a little bit later. But estrone, or E1, is the one that's typically going to be seen much more during menopausal years. It's a metabolite for the other 2. E2 is typically going to be your main dominant estrogen, so estradiol. This is the one that you're typically going to see in different types of estrogen replacements, birth control or hormone replacement. And then E3 typically tends to be the one, estriol, that you see during pregnancy, or a lot of times you'll see an increased level of E3 in bioidentical hormones so that they're getting the effective estrogen of the stronger estrogens, but it's on a weaker scale. So these are very important because we don't just measure one estrogen in the body, we have to measure them all. And typically if we're measuring if we're measuring all of the estrogens together, it may be seen as a total estrogen scale. But as those estrogens need to go through the liver in order to break down, they also themselves can produce 3 different metabolites. And each one of these metabolites has its own function. So if you think about it, they're the good, the bad, and the ugly of the estrogen metabolite system. How do we utilize them and how do we excrete them? They can typically be measured in urinary substances, which we'll talk about later. The 2-hydroxy tends to be the good one, which actually gives us we know that we're breaking down estrogen at a proper rate and rhythm, and that we can utilize it in the body, but it's not overdone. 4-hydroxy estrogen tends to be kind of the ugly one because we don't hear a lot about it, but it can tend to be involved with more estrogen dominant issues. And 16-hydroxy, which is the other one other than 2-hydroxy that we test often and is utilized in a ratio conversion, that tends to have more cancer side effects and tend to linger longer in the body and also in the fat cells. So these types of estrogens typically, and their metabolites, are typically measured a number of different ways, but they have a number of different things that they do. Estrogens in general are there to help with changing reproductive function throughout the breast, the uterus, the vagina. They help with the proliferation of endometrium within the uterus. Estrogen helps with bone growth and actually slows down bone reabsorption. So essentially that we're building and growing bone at the same time. It also has a mild effect on water and salt retention. And so it has been used in some cases for mild edema. It possibly has a chance to increase blood pressure though and clotting issues, which is one of the main reasons why people on estrogen have to also be careful if they're smokers because of their increased clotting risks. And essentially they can also, in research, decrease the plasma levels of LDL, which is the bad cholesterol, and potentially increase HDL and triglycerides, which is often one of the reasons why you see estrogens used in heart health, especially in menopausal years when the risk of cardiovascular disease increases. And finally, what you do see is that it needs to be balanced out with some of the other hormones in order for its stimulating effects not to become too stimulating in the body. And the ones that do this are some of the other hormones listed on this particular page, such as progesterone, testosterone, DHEA. And these particular hormones have their own effects that typically help to balance out estrogens in the body as well too, and they can also be measured. And when you think about the way that there's the yin and the yang of the world, basically estrogen and progesterone can make the yin and the yang of when we think about pregnancy and fertility. Since estrogen is going to be in the beginning of the cycle and progesterone will be to the end of the cycle and into pregnancy. And estrogen and testosterone going to be the yin and the yang of a cycle because of looking at as the male and the female hormone as well. DHEA tends to be one that we talk a lot about with anti-aging because it tends to help out the adrenals in dealing with our chronic stressors. So we can measure that a number of different ways as well too, and even supplement in that exact same dose. One of the things we do want to think about when we think about estrogens is it natural to our own body or is it a synthetic source as well too? Different types of synthetic sources could be things such as xenoestrogens from plant materials, plastics, hormones injected into meat or fed to animals, and it comes out in our meat products. Different types of birth control pills, whether they're monophasic, biphasic, or triphasic, or as we mentioned as well too, different types of hormone replacement therapies like Premarin, which is the pregnant mare's urine. Overall, we will need these hormones to be in balance with each other so that way they can essentially function and give us a normal reproductive tract, but also have an effect on a lot of other areas of the body. All the hormones tend to work together, as I was getting at, and essentially, yes, while it's important to influence reproductive function, we also need it to actually help out with the mind as well too. So it actually helps out with things like sex drive, our mental, emotional ability to heal and bond, and other things like the heart health, which we'll get into. The steroid hormones themselves also have to be made in different areas of the body. So during reproductive years, estrogen tends to be made in the ovaries thanks to signaling from the brain. But then the adrenal glands need to take over and essentially start producing estrogen as well. The adrenal glands are also known to produce epinephrine and norepinephrine, which is our acute fight and flight response. They also produce cortisol and DHEA, which can be driven and be higher in long stressor responses and tend to drive the sympathetic nervous system, the fight-flight system. When we think about these types of hormones, we also can't forget to leave out some of the other interesting ones that play together with these hormones, and that's the thyroid hormone, which we typically measure at TSH, T3, and free T4, and also insulin, looking at the results that blood sugar balancing has not only on different health conditions, but it also can have an effect on, say, another hormone like testosterone, and you may see this more so in a case of blood sugar resistance and metabolism in a woman who has PCOS. And we always have to remember that these hormones are cycling throughout the body. So even within a couple of hours of the day, they can be quite different. So when we look at it, hormones and measuring hormones and the effects they have on the body, we have to think about where a person is within their monthly cycle, where a woman is essentially within their reproductive cycle, but then also sometimes where they are within the day as well too. And that goes for men as well too. So we'll talk a little bit about cycling and how a feedback system helps us to maintain our own hormones. When we look at the hormone connection, we have a number of different ways that we have feedback systems to help connect to the hormones. And this is where functional medicine starts to play in there, because you start to notice that there are other changes other than just your hormone levels to essentially help out with men and women. On the left, you see the HPA axis, and essentially what that is hormones that are released from the brain, or the main master controller, go throughout the body through certain tracts, and they reach their destination. So in this particular case, you have hormones that are being released from the hypothalamus through the anterior pituitary and eventually make their way to the adrenal glands and the kidneys. From there, in the adrenal glands, cortisol can be produced, and essentially the body recognizes that there's more cortisol in the body, and so it turns off the brain signal to make more. However, if you increase things such as stress and the body's ability to need more metabolic demands, more energy, the stress is going to increase that pathway, so that basically it's driving the system to require more and more cortisol to be performed. And when we look at the adrenal glands on the right, you see kind of what happens when it comes to these different hormones. For the sex hormones, cholesterol is always going to be the basis, so we have to look in overall health what cholesterol's effect is on the body. How much are we getting in? Do we have good levels of cholesterol or bad levels? And essentially how the body utilizes those. Within the different layers of the adrenal glands, we produce different hormone levels such as DHEA and progesterone as markers that leads to another layer that's much deeper, eventually getting into what we call the three-layer cake. Progesterone itself can go down a pathway that leads to aldosterone, which is essentially a hormone that helps out with our water metabolism and maintaining minerals. And so the effect is essentially felt into the kidneys and also in the skin. Progesterone can also continue on to produce cortisol itself too, so the long-term stress response that we talk over and over again, that's really easy to push into the body, making more cortisol when we feel like we're under stress. And then finally, it can actually lead to the production of the sex hormones, estradiol, and estriol, as well as testosterone and its other counterpart, dihydroxytestosterone. So the sex hormones is just one hormone part of the adrenal system. At no time when we help to give adrenal support do we know that it's exactly going to affect the sex hormones. It could affect cortisol, or it could affect androstenedione. So essentially, we know that things start to cycle, so there are feedback loops that are involved with not only the adrenal glands, but also how the hormones are being produced. thing to keep in mind when it comes to hormones, especially with something like estrogen, is that the hormone itself needs to be picked up by a receptor. And different tissues have different types of receptors. For estrogen in itself, there are estrogen alpha and beta receptors, and these tend to do different things without the body. That tissue that picks it up then will have some kind of response. So if it's the receptor that essentially picks up estrogens in the breast tissue, it may increase breast to increase or help produce milk or start to change. If it's one that's a tissue receptor that's in the ovaries, it may help to create an egg and help with the follicular phase of the body and essentially lead to an egg for ovulation. If it's a tissue responder in a cell that may be not differentiated and essentially may be cancerous, that could essentially trigger up more growth as well there too. So there's positive and negative results. We always have to think about outside factors as well too. Those xenoestrogens and our sleep-wake cycle and how we deal with stress can have a lot to do with how our body actually responds to the receptors and responds to different types of hormones. So here you see different types of factors, such as basically our night sleeping cycle having the effect on the body of not only different types of hormones like melatonin that we usually think of for sleep, but essentially we have these cycles built into us. The same type of cycle can be seen with the follicular phase and the luteal phase of the menstrual cycle and how different hormone levels fluctuate during then. We know we can track these different hormones at different levels and essentially help to figure out why someone may be having healthcare issues on their own. So the next thing we want to look at is how do we test hormones in the body? We know we can feel the effects of it, but sometimes we don't know exactly what our levels are, and are they always needed? So one of the interesting things is I always like to tell people it's great to kind of go through a number of different symptoms and types of checklists to see how severe different types of things are that are related to different types of hormones. Example, how do joints feel? How is any kind of heart palpitations or rapid heartbeats? Is there any kind of dry, brittle hair, thinning skin? All this can give us signs and symptoms that, one, we need to probably look a little further and maybe test hormones, but also what we might expect to see changing when we start with treatment. The other thing it also helps to do is help to differentiate what type of testing would be best for this person. So typically I put here 3 different types of tests that you're using to test hormones. The first would be a blood level, and so this would be kind of a blood draw like you get at your normal doctor's office. So it may be fasting or non-fasting. And essentially, it's great for looking at things like thyroid levels, which we would look at as TSH, free T3, free T4, often T3 uptake. We may also look at to see if there are antibodies specifically for the thyroid that might be causing autoimmune diseases. We'd want to look at blood chemistry, so basically how our electrolytes are, our liver and kidney enzymes. It also gives you a basic glucose level, so you understand how blood sugar is. And it also sometimes gives you a basic lipid level to know how your good and bad cholesterol is doing. If that wasn't added, we essentially add more things on there if we think that there's an issue somewhere else in the body. But basic blood chemistry and some of the blood have a certain issue is you're getting a certain freeze frame of time when that particular blood was drawn. So you may not get an accurate representation of how enzymes and how hormones work throughout the day. And it's also that those particular substances are also bound in the blood. So essentially they're not actually being utilized, they're just kind of in transportation. A second way we look at hormone testing might be looking at a saliva sample. So now you're actually seeing the amount of hormone that's going into a cell and what it's actually doing. I tell patients this is like what we're feeling. And so it's a different test that doesn't always get run, but essentially you do it multiple times throughout the day. So this is great if you're looking at adrenal stress indexes, which is looking at cortisol levels through 4 times throughout the day. You can also look at things like the different sex hormones, estrogen, progesterone, DHEA. You may be able to look at insulin levels and to also see perhaps if there's an insulin tolerance. So saliva gives us another example of how we're utilizing the hormones. And the third example is a metabolite urine test called the dry urine test. And essentially that Dutch test, what it does is it looks at the sex hormones. It can look at cortisol and other types of hormones as well too, depending on the testing manufacturer, such as metabolites for melatonin as well too, which typically you can't test because essentially it's light sensitive. So unless you were in a dark room all the time, you probably still couldn't test it. And these types of results tend to come back within a range, but the good thing is you can look at a range for someone who is still menstruating, or women that are essentially postmenopausal, and know that those particular ranges are seen basically through the urine that's collected throughout the day. It tends to be a lot easier test to do because you can collect a urine sample and then basically insert a piece of paper, and then that piece of paper is what's sent to the lab. So it's a lot easier to do at home and less complicated, and typically comes with another set of typical symptom survey like you see here on the right as well too, to help determine what there might be a problem with. Those different metabolites can help us kind of understand how the body's breaking down hormones, and not only the best way to move forward with treatment, but also to understand where there might be an issue with breakdown. So again, we go back to, if we're looking at women who break down hormones on a much slower level or differently than men, we may be able to see exactly where that problem's happening and address it there. Once we start to look at that, we start to think about the natural supportive hormones as well too. And a lot of the times we have to do this in short-term and long-term plans. For example, if I have a case of a woman who's coming in with menopausal symptoms such as hot flashing, night sweats, vaginal dryness, irritability, low sex drive, there are things that we definitely want to make sure that we treat up front. Some of the discomfort and symptoms like that I just mentioned would be some of them, but then you also have to think about how do you make sure that the hormone levels are there to balance out some of the longer term issues that she might be feeling during menopause. Her risk of cardiovascular health has just increased. Her risk of osteoporosis may increase. So we have to think about the long-term plans of how not only do we deal with balancing hormones now, but also for the future. So that might take into consideration a number of different natural treatments. Diet, herbs, and different types of therapies can be combined directly for that person to essentially come up with the best balance. So while someone's trying a Mediterranean diet to help out with heart health, they may be using some herbs such as the ones listed here, like chasteberry, black cohosh, maca, and dong quai, to help balance out the estrogen and progesterone levels as they start to change during menopause. And then they may be using therapies such as different types of exercises and stretches to help maintain physical health, and also resistance weights to help maintain bone health. But they might be also doing acupuncture to help relieve stress, to help decrease cortisol levels, and to help with sleeping and other issues. So a great estrogen type of plan or hormone plan that you look at has to include a number of different aspects. So it's supporting not only the body detoxing the estrogen through the body and utilizing it, but also that those tissue receptors can benefit from it as well too. We have to help support the metabolized system, the process, making the hormones, using the hormones, and breaking it down. And then basically this requires looking again at liver function like we mentioned before. And not only just giving liver herbs such as milk thistle, or avoiding different herbs like grapefruit itself with certain types of medications, we have to make sure that liver function can function properly. And we can see this by not only looking at hormone levels, but sometimes drug levels that are being produced, and also insulin and glucose levels as they're being broken down. And a new old way of looking at it also is to make sure we're dealing with chronic long-term stressors. If the body's in less stress, it's able to function better. So the adaptogen herbs such as ginsengs and ginsengs and astragalus are some of the ones that we're essentially seeing start to rise on the market, or they're being combined with different types of herbs for hormone health that essentially help become the stars of medicine and actually help us deal with how our adrenals are dealing with the hormones themselves. So now that we've talked about how hormones affect the body, how women are a little bit different in breaking down hormones and medications, let's talk a real brief about a couple of conditions that we see in female medicine that's beyond the reproductive tract. Now, it's still going to include the breasts and the lymphatics and the pelvis, but essentially we're talking beyond reproductive issues and essentially on a number of different ways that we treat the body as well too. And each one has a little discussion on a natural therapy as well that we might use to help boost the immune system or to help out with blood flow or lymphatics as well. And it also takes into consideration the structural work that we do with chiropractic care and also with acupuncture as far as working the nerves and the energetics. The female immune response is actually kind of interesting because females tend to have a different type of immune response than men, especially when it comes to inflammatory autoimmune diseases. Women tend to have the type of immune cells that tends to have more issues with autoimmunity or cells that can attack itself, versus men have more general immune issues. So in the long story short, what does that mean is men tend to have symptoms such as the common cold a little bit more often, but women tend to get more aggressive autoimmune type diseases. That's why you typically see things like rheumatoid arthritis and lupus higher in women than in men. Men, when they do get these types of autoimmune diseases, however, tend to be more severe in the disease, but again, they require a lot less. There's also a lot of hormonal factors that play into our immune system and how we fight off disease and illness, whether that's a respiratory disease or a urinary tract infection. And so when we talk about estrogen's effect on it, with estrogen, it tends to decrease, estrogen tends to increase our immune responses, and testosterone and DHEA can tend to be more of a guarding and benefiting fact. So this might be one of the reasons why men who typically have higher testosterone and DHEA tend to have a lesser reactive immune system. There's also many differences within different types of races as well, comparing the African American immune system tends to be more reactive than, say, the Caucasian or the Hispanic one. And also the fact that there's a different type of inflammatory cascade, which we've been hearing a lot about lately as an issue of creating an immune response. And it tends to also act and increase during the risk of having estrogen in the body, can increase the risk of cancer, infertility, heart disease, and depression. So essentially what tends to happen is that our regulation of different types of hormones, but especially estrogen, during childbearing years and during transitional states going from menopause, and our use of oral contraceptions or hormone replacement therapy tends to aggravate certain types of conditions. And a good example of this can actually be something like asthma, which can be an inflammatory state itself or actually be something that's brought on after a chronic infection, but it tends to be worse before and during menstruation, where you see different estrogen level changes. In order to boost the immune system, then not only do you have to give immune boosting herbs and understand where the immune factors are coming from, but essentially you have to regulate some of the genetic components as well too, and make sure you're giving herbs that are good for the different types of autoimmune reactions that are happening. A good example of this might be lupus, and it may be that in the female immune system, because it tends to be more reactive, we tend to get very vague symptoms. One autoimmune disease tends to lurk behind another, so we tend to be able to identify in women that we should look at long-term goals of also making sure that they essentially are not at risk for other things, other autoimmune diseases. Lupus in itself can typically be seen with fatigue, joint pain, mood changes, kidney issues, weight gain, chest pain and shortness of breath, and anemia and skin rash, typically the butterfly rash. But it's a very difficult disease to basically diagnose and rule out because it tends to act like a lot of other diseases. So when we look at why females may be more susceptible to lupus, it may have to do with these underlying immune effects. So in order to treat lupus, you have to treat the immune system itself. There's also the human factor of disease too, which we can't test, and we know that different people are going to always react in different ways. And so when we take into consideration coming up with a treatment plan to balance the female immune system, we have to take into consideration that the immune system is trying to basically tell us that there's something going wrong with the body and that we don't want to necessarily suppress it, but we want to optimize it and try to get the inflammation reaction down. Another issue you see commonly with female diseases is the rise of cardiovascular diseases, especially after menopause. And there can be a number of different theories on why this happens. But one of the interesting things also is the fact that the idea that if we have increased fat cells, say in and around our heart, the estrogen in itself can kind of affect essentially the way that those estrogen or those heart cells actually work. So there's a slightly higher risk of disease in menopausal women who are overweight because the estrogen leaves around longer. And those fat cells can be in the heart, can actually block arteries and veins that are especially feeding the heart itself. Because we talked about this earlier, the fact that there's a lack of women's information on how they respond to different types of diseases, and cardiovascular disease can be one of those main issues. Unlike the normal symptoms of a heart attack that you see in a man, typically women tend to have less severe symptoms, so they may not necessarily call out for help or seek help when it's necessary. Things like fatigue, nausea or vomiting, sharp pains throughout the body and the arms, chest discomfort, shortness of breath, and increased sweating or lightheadedness and dizziness can be signs of heart attacks, that can also be signs of a lot of other different things. So the typical patient who has more heart issues that tends to ignore it may not think there's really anything wrong with them, but essentially they could be signs of a heart attack. So women should be more careful with essentially making sure that they have their blood pressure checked, that they're having electrolytes checked, and they're seeing cardiovascular specialists if they have any kind of issues with electrical balances in the heart, or even some autoimmune diseases tend to also make the heart more susceptible for different types of diseases as well too. One of the things we'd want to look at here from a conventional standpoint or from a holistic standpoint would be to make sure that they're getting good values of good fats in their blood. They're getting something like a Mediterranean diet that has decreased processed food and also essentially is decreasing any other risk factors for the digestive health. So essentially that they're getting good, strong nutrients, antioxidants that can also help protect their heart, and also these fat cells that are in the heart from oxidizing and causing reactivity. One of the things we want to look at, a different way of looking at breast is thinking about breast congestion and why it might get swollen more so, say, prior to a period, or even when we look at how the lymphatic system actually feeds into the breast. Different types of swellings, and also if there's inflammation or nodular involvement with the breast cancer, affect the breast in a number of different ways. And as you can see here, the lymph nodes of the breast, which you can see in green, are basically like trails. So there's superficial lymphatics that go from the nipple down through the breast fat and essentially divide through the fascia and then go to these lymph nodes. Now these might be palpable or not palpable, but essentially those lymph nodes are collecting waste and also can be capturing metabolic offshoots of basically cancers. So typically they're digested to see if they have cancer in them. However, when we think about this, there's two different ways that the body kind of gets rid of lymph from the breast, and one is going through the axillary area, which is the typical area that we'll check, and then also to the sternum as well too. So when we look at how a woman's lymphatic system works, we can know that we got to check multiple areas of the body in order to make sure that lymph flow through not only the axillary and the arm, but also through the breast is adequate. Often these are where lymph nodes are taken out, and it can cause a side effect of breast cancer that's called lymphedema, where you see swelling in an affected rim, but it can also be across the torso. And here's some basic information on lymphatic health and different things that we do to help basically move things throughout the body and help that lymphatic move. We want to create like a pump-like system to move lymph from away the extremities up through the middle of the body and from the upper extremities basically back into the venous system up and near the heart itself. So basically we want to move lymph towards there. So we teach patients how their lymphatic system helps out with not only their immune health, but also essentially what can be done as far as staying hydrated, keeping moving, using things like keeping skin on the outside hydrated, so that way there's less area for infection and disease, and also using things such as compression and using the muscles to move the body to help as a lymphatic source as well too. Also, deep breathing exercises can be used and taught to basically help move the lymphatics through the chest area as well too. And we want to make sure that women who do go through breast cancer treatments basically have a chance to understand that even though they're not told all the time that lymphedema could be an issue, essentially if they've had a lymph node removed, what they're looking at is already being at a 0 stage of lymphedema. So that propensity to have some kind of swelling at some point in their life is already set up, even though some women may never have symptoms or maybe years later. Other women will have symptoms almost right away. So you may see bilateral swelling or swelling in all different parts of the body. Since the lymphatic system moves throughout the body, we can use different areas of the body to help stimulate and help to move lymph that's stuck in one extremity or the other. More and more information is being taught and to patients and also to women about different signs to what to observe and how they may be able to become more actively involved in their lymphedema protocols. Next, we move on to different types of pelvic conditions. And one way, because there are so many, is looking at to see in the body, is there an excess of a condition going on or deficiency? So here I've listed some examples of things going on in the body where they may be listed as excess or deficiency. They may or may not have essentially a hormone balance issue. It may be more like an infection issue or essentially an issue that involves a number of systems. But what tends to happen is we need to look at the pelvis cavity a little bit differently than just our reproductive tract. There's a lot of intricate veins and also arteries that go to different parts of the reproductive tract that will affect flow in that localized area, but also below and above. We see this with pelvic congestion syndrome, which causes varicosity of veins, not only in the leg, but also can create issues into the testicles for men and also into the reproductive tract, the ovaries and vulva area for women. And essentially, we can see lack of blood flow or lymphatic flow give rise to things like cancer, or actually give us signs that there may be lingering long-term chronic infection diseases such as Epstein-Barr. Women tend to get enlarged lymph nodes down in the pelvic tract because they are so deeply related and intimately related to the uterus and other areas in such a small area, so they can get congested very quickly. So using things to remove this congestion, such as movement and exercise, visual scanning and working with specialists, and also looking at whether or not there are hormonal issues related to these, can all be partly related. But it can deal with having to look at how the vascular system on a very minute level, or the microsystem of the body, can basically have an effect in the pelvic area. And this can, like I said, affect a number of different conditions, whether they're excess or deficient. We can also look at how the structure of the body, or where we experience pain, might have an effect on the female reproductive tract and females in general. When we think about the fact that there are connections between one part of the body and another part of the body, it's hard to always realize this. But a lot of times sitting down with a chiropractor or with an acupuncturist to go over this helps us kind of come up with a better idea of how the body's connected together. In fact, there's a relationship between the jaw muscles itself and whether they get tight and clenched. It's the same thing as if the pelvic floor muscles can also get tense. The pelvic floor muscles are important not only for reproductive health, but urinary health as well too, and also for stool excretion. But the pelvic health in itself and the pelvis actually can be treated by looking at different types of tightness and tenderness in the jaw and the ability for everything to move. So this is one unique way of looking at one part of the body that reflects another part of the body. Also, a lot of times you'll see this being an issue that's utilized very quickly with PTs who are doing a lot of pelvic therapies, where they're trying to relax muscles that make up a larger scale system than smaller muscles that you might see along the spine itself. And we also have those annoying urinary tract issues, which may be related to overactive bladder or stress incontinence, different types of infections like a urinary tract infections, even up to interstitial cystitis, which is the infection in the bladder itself. And when we look at this, the female reproductive system and urinary system has a lot to do with the way it's set up, has a lot to do with basically why females tend to have chronic issues with this and why things may not really retrieve and heal as well as they could. And we'll look at that in just a second. But one of the interesting things is when we think about the types of bacteria, which E. coli is one of the known bacteria that basically we see as UTI as an invader, and essentially that we treat for, we have to start thinking outside of the box as far as how do we create different types of treatments that affect not only this bacteria, but other types of bacteria that might be becoming more resistant. So one of the main things that we do for that is a molecule called D-mannose, which allows the body to basically not allow the bacteria to stick to the bladder of whether it's the bacteria allowed to stick to the uterine wall, the urethral wall or bladder wall, even the kidney wall, to help flush out the bacteria itself. So when we look at the anatomy of the urinary tract system in a female, we know that the urethra is much closer to the vaginal canal, so there's less room for essentially bacteria to have to travel to create an environment of infection, whether it's in the bladder or even up to the kidneys. So they tend to have a lot of different reasons why that bacteria in those areas tends to grow pretty easily. The pH system of the vaginal canal is much more acidic, and it strives better in an acidic environment. So different types of treatment that we would use actually can add different types of acids. And in the urinary tract, you can basically use something like cranberry juice, which changes the pH as well too, to make things less hospitable for the bacteria to actually stay. And a lot of times when we go back to our hormone connection here, we might look to see if there's vaginal atrophy or dryness. And any kind of atrophy or dryness that we see there may allow for more bacterial infections to basically invade the vaginal canal or around the urethra, which can also lead to essentially different sorts of changes and infections. So one of the main things we want to do is look to see how good the microbiome, the good bacteria of the body, it's making sure that it's in balance. We have a lot of good and bad bacteria that are normally present in the body, but when they become too numerous on the side that hurts us, that's where we run into trouble. So we have to create a certain balance, and there's so many bacteria now and so much more research that's coming out now that staying ahead of it can even be difficult. So this is where we see the lactobacillus and the biobifidos tend to be the ones that we use a lot for UTI infection, and also for urinary or reproductive issues. We also need to look at other types of chronic conditions that may lead more for urinary issues to begin with. So when we look at something like interstitial cystitis, some of the main treatments that we look at from a conventional standpoint look to decrease inflammation in the local area, but then we also look at some types of foods that are triggering foods that create acidic or hot environments that basically create inflammation and more pain with urination. We also look at different types of neurological conditions such as multiple sclerosis, which has an effect on the bladder as well too, typically creating issues with incontinence and or hesitation. We know that with pregnancy, the bladder, it can be compromised and is more likely to, the pH of the vaginal canal and the uterus has changed because of the position of the baby, so it may actually lead to more pregnancy UTIs. And women who tend to not get UTIs treated, 40% of them during their pregnancy, if they don't get their UTI treated, they'll typically have recurring UTIs after postpartum. Another thing we got to consideration is any types of procedures that we've done vaginally can also affect the reproductive tract. Anything as far as any cosmetic procedures or things we've used even to treat for some of the pelvic syndromes that we had before. Say if someone had to have laparoscopy or endometrial tissue removed, some of that scarring can actually affect the bladder and the position of the bladder and also the way the large intestine will eliminate stool as well too. So these are all different ways to kind of look to how the structure of the body basically can play into a urinary condition. So some things to think about, especially with urinary conditions, because they don't get discussed often, is that involuntary leakage can happen in 50% of normal healthy women. So it's not only that there has to be a lot of changes going on, there's a lot of different reasons why we can have leakage. Stress incontinence itself is involuntary urine with an intact urethra and secondary to a sudden increase in abdominal pressure in the absence of bladder constriction. So what that basically means is that there's some kind of loss of urine basically when there's coughing or sneezing, sometimes squatting or walking stairs, even upon standing. And what's typically happening is there could be a structural change that also causes the floor of the urethra to drop below the pelvic floor. And then also estrogen deficiency can create issues and also cause laxity in the ligaments around the tissues of the uterus and the bladder. That basically allows more stress incontinence and involuntary urine loss to happen. So we see this sometimes also with generalized uterine prolapses as well too, which is something that we refer over to a OBGYN to make sure that someone's getting done. If they're doing a general pap smear or pelvic exam, they'll be able to check to see whether or not there's any kind of prolapsing. As I mentioned before, 40% of pregnant women not treated for UTIs during pregnancy may develop symptoms and additional infections later on. So this might not be something that's actually discussed very often in normal pregnancy health, especially if a woman had recurrent UTI infections prior to becoming pregnant. And while E. coli is still the #1 strain, you have to think of other causes that create urinary issues such as vaginal atrophy or tissue atrophy, different types of irritants that can affect the urinary tract, even dehydration, yeast infections or infections with resistant bacterial strains or chronic infections that aren't treated properly to begin with may all begin to modify and create infections in different parts of the body and also lead to basically greater and greater infection as well too. This is why sometimes the over-the-counter treatments don't tend to treat more than one symptom or they may treat and then all of a sudden it reoccurs later on. Stress can also be something that needs to be maintained during this time as well too. So optional treatments as we might have is at-home care, such as sitz baths, which is soaking the pelvis, hydration, and things like cranberry and D-mannose, and looking at diets to make sure that the foods that we take in or the supplements we take in create optimal urinary health. One of the new approaches to this is also using acupuncture for stress incontinence. And the reason that works is because you do have the nerve distribution that comes down on the legs, happens to have a lot of acupuncture points also located there, typically down by the ankles and then up higher onto the calf. Basically, you have points that can reflect directly over to the urinary bladder and the nerves that affect them. So OBGYNs have typically, and midwives have typically been doing some of these with using electric stim, offering it into their office, but essentially acupuncturists can use things to only treat the rest of the body as well, but they are using this based off of the nerve distribution instead of just worrying about, is there too much inflammation? There's an actual structural reason why the acupuncture in this area would work. And I find it very effective when patients come in a couple times a week for a couple of weeks. They're able to start seeing changes pretty quickly, but it's not something that's discussed very often. To wrap up, we know that the future of women's medicine really is going to be changing, especially we've seen this change happen in the last year. But there's things we got to keep that we've learned about, but moving forward and maybe make them more accessible for patients, maybe understand that patients don't always get the medical knowledge that we have, or they're getting misinformation through social media sources, and making sure that the communication that was not so great in the past basically becomes much more part of their treatment in the future. So some of the basics as far as some of the preventative medicine screenings are probably going to remain about the same, although the time and duration of each one of those screenings and what they mean for the body is going to be different. You'll see an interaction, more encouragement for interaction between practitioners and patients. How do you feel with this going on? Reach out to me more for more information. You're going to definitely see them, women asking more information about holistic and individualist type of treatments that they've either read about or they're interested in that potentially their primary care providers didn't get as much training in. So their team of healthcare practitioners is going to start to grow and increase to have chiropractors, acupuncturists, nutritionists also involved with them too. So we already see this demand starting to rise, as even if you look at the supplement industry starting to rise. But you see this with female practitioners also getting more involved with their patients as far as creating things that work better for them. What you definitely start to see is that there's been more investment in women's medicine as well too. And one of the interesting things that I think there is that basically there's different cycles of a woman's body that there's been the focus, and fertility and menstruation and pregnancy has been one of the biggest areas where more people have created apps for women to track their own ways to become healthy, or to give vital knowledge to practitioners who may only be able to do telemedicine visits with them currently, or can help actually share that information with others. So some of these apps in the fertility, menstruation area, the pregnancy, postpartum care, and menopause, and then general medicine and preventive medicine have helped and have been designed to basically kind of look at the body and take some of the observational things that women can do on their own and really reach into the future of medicine. What I also like to say is that as we're reaching into the future, we're bringing back some of the herbalism and ideas of the past as well too, and combining the best of both worlds. And of course, there's the unknown that we don't know about. And so a lot of the times I see that information or issues brought up by my patients that I haven't thought of. So I'm always opening up the conversation for them to basically kind of help develop the next set of, whether it's the PowerPoints or it's to help develop how can we use an older herb in a new way, or how do we treat something a little bit different than we did before. A preventative view looking forward of what a women's medicine should do is they should continue to get testing, whether it's basic blood work with their annual exams. Even if they're not going in for a pelvic exam or a pap smear, they should be able to visit somebody or have someone like a primary care on contact if they decide not to go in for annual exams. Doing appropriate hormone testing when it's necessary. It doesn't mean that everybody needs to have it done. And also trying to figure out, do I need something like blood testing or adrenal cortisol testing that's done through saliva, or urinary testing. Depends on what's going on and how that person responds to you. Also, blood pressure monitoring to look for heart health is always good. Having someone do checks in the morning and in the evening on both arms, making sure that they're doing the correct way. So having patients bring in their blood pressure monitoring kits to make sure that you're setting it up properly, that you know what to do when you're at home, and making sure the numbers that you're receiving are the same things that we see in the office can help. Just a really basic way of kind of looking at how your blood pressure is doing, and checking pulse and oxygen levels too will kind of help us overall cardiovascular health. Doing skin checks, this includes doing breast exams, having a skin check from a dermatologist to make sure that sun exposure hasn't led us to higher levels of melatonin and higher cancer levels. Essentially, we need to look at the skin as well too to make sure that there's not additional dryness, and the easiest thing for that to do would be to moisturize, which helps to create that immune barrier of the skin and not allow infections to go through the skin and set up shop, essentially. During a basic urinalysis, when we feel maybe urinary burning and tingling or hesitancy or urgency, it's a great way to get started to try to diagnose if there's also something else going on into the urinary tract, since urinalysis can be very basic and tell you if there's any blood or glucose in the urine too. So it's something that's very simple that can be done. We always have our patients do dietary logs to find out what their foods and liquids are like when they're eating, when they're sleeping. There are common patterns that we see. We may ask them to do an expanded lipid panel, which also looks at cholesterol, the good cholesterol and the bad cholesterol, but from an expanded level to say where, when someone says you have bad cholesterol and it's really high, we can actually start to identify more markers within there to better treat the female patient. We want to look at different types of inflammatory factors which might predispose us to different types of diseases such as autoimmune disease, and understand that autoimmune disease can be very difficult to treat and very difficult to diagnose. So you have to create an individualized patient program for them. But some of these markers will kind of tell us if we do have inflammation in the body that needs to be addressed first. We can use other tests to help out looking at bone turnover instead of just using a DEXA exam, to also know that if our therapies are working well, since bone should be turning over with loss and gain at the same time. So that can be tested in the urine. We can look at the adrenals to see how we're dealing with our stress and how our stress hormones are being produced by looking at it 3 or 4 times during the day, usually at 8, 12, 4, and 8. And essentially by doing that, you see how the normal rises and flows of the body of cortisol and how we deal with stress, as our mornings making us wake up alive and awake, and our nighttimes letting us sleep. So there's a lot that we can look at as far as an adrenal stress index too. And that tends to be a saliva test. We may also look at comprehensive stool analysis if someone's traveled a lot, or if they're not breaking down foods correctly. It would help us kind of look at a number of different factors of what we're seeing in the stool, or looking at it this way as you're seeing a metabolite of what's passing through the body. So it's another way of kind of saying, how is my digestive tract doing? And I guess we're also looking for new technology such as thermography, which can be used for the breast screening or for body screening to look for spots of generalized inflammation and temperature change, which you typically might see with neurovasculation in and around, say, a breast tumor or cancer, or be able to help as another tool for younger women who are not doing breast scans yet and have denser breasts. Thermography is another way to kind of look at not only the breast but the full body as well too, to diagnose, say, areas of pain that aren't being treated well. The last thing I want to do is explain treatment suggestions that we hear a lot. I feel like women get told this a lot, but they don't really know what to do. And this is some of the information that we go over them when we're coming up with our plan, to essentially say, when you've heard these phrases, there means a little bit more. We need to explain them a little more. And so a lot of the times they're told to exercise more, eat better, and we'll talk about diet on the next time, or set up a certain time to talk about it. Lose some weight, try to relax more, try different types of stress management, and you don't need to do that PAP screening or the screening test because you're too young or too old. And essentially what we need to do is take these and really explain them a little bit better to our patients to understand that these are all factors in their health, but you have to look at the whole overall health. And so when you're telling someone to exercise more, if they're having joint pain or they're having difficulty moving, they're not going to be on a cardio treadmill routine every single day. They might only be able to do some simple yoga in a seated position. When we're telling them to eat better, we have to make sure they have access to good, clean food as well, too. And if they don't know what that is, we need to find out, when do we choose organic foods, and say, when do we choose foods that we're get at a regular grocery store, or we get frozen to make it more accessible. If we're talking about losing weight, it talks about setting up examples of how to lose weight, how to combine it better with not only stress management, but also with exercise, moving right, and eating right. When it comes to stress management, we need to look at what works for that person, because not everybody de-stresses the same way. But we're seeing stress as a major issue in a lot of chronic illnesses, so it has to be addressed properly. And finally, when we talk about screening tests that are called preventative screening tests, we have to examine what preventative medicine is. Is it just simply to not have a cancer? Is it simply not to essentially have a family history of something? What we need to do is explain these a little bit more. And if there's another example of what we should be doing, such as moving into the future of genetic testing, looking at the way environment affects us and where we've lived and what we do as an industry and what our jobs are, can have a lot to do with as a screening test than one that looks just at the reproductive tract. So overall, what that does is gives us a better example of whole body medicine and trying to create individual care for the woman who's standing before us. And really, that's going to be what brings us into the 2021 in a strong way too. So hopefully you'll get some of this information. And even though it's a lot, there's a lot of different things that can be talked about one-on-one, and happy to answer any questions. And you feel free to email me along the way as well too. When you're looking to get involved with the health, you have to look at things a little bit differently. Look at it from the triad of health perspective. How do I feel structurally? How do I make changes biochemically? And how do I express myself mentally and emotionally? All of these are part of our overall health care system. And so a lot of times, a lot of the focus is put on the structural and biochemical side without even going into the mental, emotional side. It's easy to leave that side by itself, but we have to look at how stress affects us. We have to be able to set goals with our healthcare team. The team includes you as a patient. Women need to be able to speak up for themselves and actually give themselves as much appreciation as they need, because essentially you know your bodies better than we do as a doctor. It's beyond some of the textbooks that we use. We need to learn from you so we can treat other women as well too. So that means becoming involved with your healthcare team is the best way possible. And becoming informed, but not just to be compliant, not just doing what you're told, but making sure you understand the information that we're giving to you. And if not, the best way to do that is to ask questions, is to come up and research ones, to look at educational samples, to look at social media, but to also know when to question it as well too. So for women's medicine, that means that social support needs to be there, and making sure you have Me Too time to set aside that you can work on your particular goals, whether they're a healthcare goal, a social goal, or a reproductive goal. You have to make sure that you give your time in order to heal and to support yourself in order to come forward, or everything else as far as testing and looking at hormones really won't mean anything. So hopefully you enjoyed this lecture. Feel free to email me at s.pina@rosellecare.com if you have any questions, and I look forward to seeing you at the Roselle Center for Healing, whether it's on one of these topics or any of the other topics. Thank you for listening. Thank you for watching this Roselle Center for Healing educational series. I hope you enjoyed the lecture and learned something new about what we offer at the Roselle Center for Healing and what to expect. I'd love to see you in person so I can answer any of your questions about this series or any other series. Or if you have friends and family who would also like to take advantage of this offer, feel free to give it to them. As part of our lecture series, we always offer a chance for you to come in to meet with us and sit down and discuss your particular issues and individual treatment options. For a $99 tax deductible fee for caring for others, we will sit down for approximately an hour and go over your particular plans and what might be the best treatment strategy for you. As I mentioned, if you know of friends or family who might also be interested in this offer, feel free to have them watch this webinar and then contact me yourself. If you have any questions related to this particular seminar itself and you'd like to talk to me directly, please use the email that's located on this screen. This tax-deductible offer is good for new patients or having patients who haven't been in the office for over a year. It's a great way to not only give back to others, but also to yourself. And this money towards caring for others actually goes towards educating those that are interested in the healthcare professions of chiropractic, applied kinesiology, acupuncture. It also helps give us more educational funds for treating people with natural solutions and help those who can't afford care. Feel free to give the office a call at 703-698-7117 and ask them to take advantage of this particular offer with me, Dr. Stephanie Pina. Again, I hope you enjoyed not only this lecture series, but also will listen to the Roselle Center for Healing radio show and check us out on our website at rosellecare.com. Thank you for your attention.